take this opportunity to place on record that during the last 1.5 years of, or almost 2 years now, of COVID pandemic and its management, NIB set new standards. NIB for the first time acquired the know-how and the skill set to be a central drug lab CDL for vaccines. That work should be taken forward. You should not keep it limited to paper saying कि हमको मिल गया, उसके बाद आप क्या कर रहे हैं वो भी आपको देखना चाहिए. But this is a credit worthy achievement and we must appreciate it. We must also appreciate the kind of quality control testing that you established for COVID diagnostic kits. जब मैं VTD की बात करता हूँ तो उसमें diagnostics is a critical component. वो भी आपने पहली बार किया during the COVID crisis, and obviously COVID vaccine is something that I just pointed out. So these activities should not become one-off. एक बार कर दिया तो बहुत अच्छी बात है, लेकिन उसको फिर आगे ले जाने की जरूरत है. So to sum up, I congratulate you for all your achievements. I have forgotten, you have also started your PhD courses. So we must congratulate you for that also. And I should again, before closing, suggest that whatever collaborations that NIB has today with the regulator on one hand and with the industry and academic institutions on the other must be strengthened, and we wish that you would establish new standards of quality control in the country, and you would play a leading role in networking with other such globally established institutions. So I once again wish all of you well. मेरी शुभकामनाएं आपके साथ हैं आपके 31वें फाउंडेशन दिवस समारोह के अवसर पर, और मेरी शुभकामनाएं इस नेशनल समिट के लिए भी हैं कि इससे कुछ कॉन्क्रीट चीजें निकलें जिसको फिर आगे ले जाने में मंत्रालय और NIB मिलकर काम करें. बहुत बहुत धन्यवाद. एंड एक्सेस, ये चैलेंज है, ये चुनौती है, और उसमें क्योंकि मल्टी स्टेक होल्डर एक्सरसाइज है ये, तो रेगुलेटर्स को भी काम करना है, जो क्वालिटी टेस्टिंग करते हैं उनको भी करना है, जो मैन्युफैक्चर करते हैं उनको भी करना है, और जो प्रोग्राम मैनेजर्स हैं मुझ जैसे लोग या मेरे मित्र जो उस तरफ बैठे हुए थे, हमारा भी रोल. तो ये एक महत्वपूर्ण चीज है जो हमें अपने दिमाग में रखनी चाहिए एज वी गो अहेड. I also believe that institutions like NIB cannot exist in isolation. So they need to interact on a regular basis, not only with the national regulators, that is CDSCO, Central Drug and Standards Organization. They should also be dealing with the Indian Pharmacopoeia Commission on a regular basis, and also interacting with the industry again on a regular basis. And they must keep their channels of communication open with people who have worked in the field and are working in the field, who can contribute domain knowledge. Dr. Gupta is one such example. He's just joined us. We welcome him. So, NIB will remain a vibrant organization only when they keep all these channels of communication open. We must also not lose sight of the fact that in today's global world, until and unless we build collaborations, we will not progress. So NIB should actively explore collaborative arrangements with similar other organizations in G20 countries. And if you need any help of the ministry to take those MOUs or agreements forward, that is something that Rajiv, we should be pushing on a proactive basis. So would Gopal help in this exercise? So please do not lose sight of the fact that while within the country you may be doing exceptionally good work, you must build networks. You must be part of electronic networks, physical networks of institutions that go beyond the country boundaries. That when we have gathered here today, we also are chairing the G20 group of nations. The G20 presidency is with India today, and this presidency will continue till the end of 2023. And within the presidency, there are various tracks. There is a finance track, उसमें अलग से negotiations member countries के बीच में होते हैं. There is a health track. There is an environment and climate change track. So, in the health track, the three priorities that India has put on the table for G20 countries are dealing with health emergencies, one of which is still we are in the midst of that health emergency, which is the COVID-19 pandemic. The second priority that we have put forward, and this is why I am sharing this with you, the second priority is how do we ensure equitable access to quality BTDs, vaccine, therapeutics, and diagnostics. And the third priority is how do we proceed towards universal health coverage using digital solutions. So while we interact and deliberate on ensuring quality of biologicals, more efficient testing, science-based protocols, so on and so forth, engaging with regulators, engaging with industry, we should not lose sight of the fact, why are we doing all this? अगर हमने समय घटा दिया टेस्ट करने का तो क्यों? अगर हमने ये कहा कि हमें इतनी ज्यादा क्वांटिटी में सैंपल नहीं चाहिए, कम चाहिए तो क्यों? Eventual aim is not to make the process simpler. Eventual aim is not only be governed by science. Eventual aim is to promote that those products are available in the market, and they are available for everyone, and they are available at a prescribed level of quality. अल्टीमेट एम तो वो है, लक्ष्य तो वो है, इसलिए आप ये सब काम कर रहे हैं, इसीलिए आपको वो इनाम भी मिला है, जो भी मिला. तो हमें ये सोचना है, गोइंग अहेड, we are a country which is popularly called the pharmacy of the world. Every fourth child in the world is inoculated using an Indian-made vaccine. So we are virtually the vaccine capital of the world. But what are we doing and what should we do more going ahead to ensure